Hello, everyone, and welcome. I'm excited to have you here today. We're about to explore a fascinating and important topic, Naegleria fowleri, also known as the brain-eating amoeba. In this presentation, we'll cover what it is, how it affects us, and what you need to know to stay safe. So let's get started. Today, I want to introduce you to a type of free-living amoeba that's quite rare but can cause a serious brain infection called primary amebic meningoencephalitis, or PAM. Despite how uncommon it is, when infections do occur, they tend to be severe and rapidly progressing. You'll find this amoeba all around the world, particularly in warm, fresh water environments like lakes, hot springs, and even some poorly maintained swimming pools. Its widespread presence highlights the importance of understanding how it can affect us, especially when engaging in recreational water activities in warm climates. This slide helps us grasp the significance of this microorganism in the context of infectious diseases, reminding us that even rare pathogens can have serious implications for public health. So, where does this organism live? It primarily inhabits warm freshwater environments. Think about lakes, rivers, hot springs, or even poorly chlorinated pools and warm water systems. It really thrives in high temperatures and stagnant water, which creates ideal conditions for its growth. Now, let's talk about symptoms and how they develop over time. In the early stages, you might notice a headache, fever, nausea, and vomiting. These signs can sometimes be mistaken for bacterial meningitis, so it's important to pay close attention. As the infection progresses, more serious symptoms can appear, such as a stiff neck, confusion, seizures, and even coma. The onset of symptoms usually occurs a few days after exposure, and the disease can progress very rapidly once symptoms start. This is why, if you've been exposed to warm freshwater and begin to experience these symptoms, it's absolutely urgent to seek emergency care immediately. Prompt treatment can be life-saving, so don't delay if symptoms develop. So let's talk about how this infection actually happens. It's important to understand that the amoeba enters the body through water, but not by swallowing it. Instead, it gets in through the nose. This is a key point because the nasal passage is the main route for infection. Once the amoeba is inside, it migrates along the olfactory nerve, which is the nerve responsible for our sense of smell, and it makes its way into the brain. This pathway is what makes nasal entry such a critical risk mechanism. Recognizing this helps us understand how easily the infection can reach such a sensitive area, emphasizing the importance of avoiding contaminated water during activities like swimming or diving. Let's talk about how this condition is diagnosed. Typically, diagnosis involves analyzing the cerebrospinal fluid, or CSF, through microscopy and PCR testing. These lab tests are crucial for confirming the presence of the pathogen. Additionally, understanding the patient's clinical history is important, especially recent freshwater nasal exposure, which can be a key clue. It's worth noting that early on, this condition is often misdiagnosed as bacterial meningitis, which can delay appropriate treatment. That's why having access to proper lab facilities and maintaining a high index of suspicion are so vital. Moving on to treatment, there's no single proven cure for this infection. Instead, we rely on combination therapy, such as amphotericin B, miltefosine, along with supportive care. The key point here is that early and aggressive treatment offers the best chance for recovery, although even then, the prognosis can still be limited. And a quick note, treatment is urgent and complex, so it's essential to consult infectious disease specialists or the CDC to guide management. Prognosis, as many of you may know, PAM is a serious condition that progresses very rapidly and is often fatal. Survivors are actually quite rare, which highlights just how aggressive this disease can be. So when we talk about prognosis, it's important to be clear. Prevention is really our best strategy here. Now, moving on to prevention, this is where practical tips come into play. First, one of the key things is to avoid getting water up your nose. Simple solutions like using nose clips can help, or you can keep your head above water, especially in warm freshwater environments where the risk is higher. Another critical point is to steer clear of warm, stagnant water and poorly treated pools. Proper chlorination of pools is essential to reduce the risk of infection. These might seem like small behavioral changes, but they can significantly lower your risk of contracting PAM. Overall, the message is clear. Being mindful of your environment and taking simple precautions can make a big difference. Prevention isn't just about reacting to illness, it's about actively reducing your risk in everyday situations. Let's wrap up with some key takeaways and references. First, it's important to remember that this pathogen is quite rare, but when it does cause disease, it can be severe. So, preventing exposure is crucial. The main point here is to avoid nasal exposure to warm freshwater, especially if it's contaminated. If you or someone else develops symptoms following such exposure, seeking immediate medical care is essential to manage the situation effectively. For those interested in learning more, I recommend checking out the CDC's fact pages and clinical guidance, which provide detailed information. Additionally, recent MMWR reports and clinical reviews offer valuable insights into current understanding and management strategies. Overall, the key message is to stay vigilant, prevent exposure, and act quickly if symptoms develop. That way, we can better protect ourselves and others from this rare but potentially serious disease. Thanks for watching, everyone. I really appreciate you taking the time to be here today. If you enjoyed this presentation, please remember to like and subscribe to our channel at UPX Magazine. Your support helps us bring more valuable content your way. Thanks again for your time, and I look forward to seeing you at the next one.